Okay, there are 5 steps in ABP process. So these 5 are the 5 A's: the ask, assess, appraise, apply, and then to assess. So we will discuss this one by one. Your first step in EBP process is ask. Tanungin mo, what problem or concerns do you have for your patient? Ano yung concern? Ano yung problem na gusto mong i-address sa pasyente mo? So, in asking question in step 1 of the 5 EBP-based practice process, you need to take note of the mnemonic PICO. P-I-C-O. P stands for patient, I intervention, C comparison, and O outcome. So, what to think about when you are dealing with the patient problem or the population? What are the patient's demographics? Ilang taon yung pasyente? Taga saan yung pasyente? Baka kasi yung taon niya ay may kinalaman doon sa problema. Baka yung kanyang location ay may kinalaman doon sa kanyang problema. Baka yung kanyang lahi, yung kanyang religion ay may kinalaman doon sa problema. Baka risk factor kasi yung mga ganitong line up para doon sa pasyente. Or what is the problem type? So, ang example dito, yung pasyente, meron siyang work-related neck muscle pain. So, sa trabaho niya, dumaranas siya ng muscle pain. Saan? Sa bandang neck or sa bandang leeg. So, the next question or the next element would be your intervention. What type of intervention is being considered? So, para ma-address mo yung problema, pwede ka rong magbigay ng example. Some of them are by means of medication or some other type of exercise or kaya pwede mong i-rest. Sa given example, sabi niya yung work-related neck muscle pain, mag-i-intervene siya sa pamamagitan ng strength training. Diba sabi nga, pag masakit, ulitin mo yung ginawa mo, mawawala yung sakit. So, ulitin mo lang daw. So, that would be the strength training of the painful muscle. And then, of course, para matest mo yung intervention and then mapag-compare mo siya, you need a control. So, there is a comparison treatment to be considered. Ano pa yung iba mong intervention na pwedeng gawin? So, pwedeng medication, bigyan mo siya ng medication, kasama yung, or strength training. Pwede mo din naman siyang bigyan ng exercise, ito nga yung gagawin mo. Or pwede mo siyang bigyan ng rest. Or pwedeng yun na yung no treatment at all. So, pinag-compare niya rito yung effectiveness ng strength training of the painful muscle, yung exercise, and then the rest, or yung wala kang gagawing treatment. Basta ipapahinga mo lang yung iyong neck muscles. And then the outcome. Ano yung gusto mong maging outcome? So, syempre, the pain relief, para mawala yung pain relief ng pasyente. What should be the desired effect you would like to see? What effects are you wanted? Are there any side effects involved in this form of testing or treatment? So, that could be the interplay for PICO or the PICO process. Some books, meron na siyang letter T, PICOT, di ba? O, di ba? PICOT, wherein T stands for time. So, wala namang problema sa time or sa letter T kung i-include mo siya. Kasi lahat naman ng unit referring to time, yun ang dadagdag mo. Such as hours, days, weeks, months, or even years. The next step is your acquiring or accessing the evidence. So, pag nagkaroon ka na raw ng problema, saan mo hahanapin yung mga backup mo para patunayan mo or ma-explain mo yung problema. As you can see, in February 22, 2016, sabi ng status ko sa FB, what's for dinner? Cochrane collaboration, Campbell collaboration, meta-analysis, anyone here knows. Kasi during that time, I'm doing a research and totoo namang hinahapunan ko ay ang Cochrane collaboration. And then yung mga databases I've mentioned such as Medline, PubMed, CINAHL, National Guidelines Clearinghouse, and then the Cochrane Library. So, andyan yung mga peer-reviewed, andyan yung mga makabuluhan, andyan yung mga scientifically published research na pwede kong maging basihan or pwede kong kuhanan ng reference. The next would be appraising the evidence. This is the very crucial. Appraising, punta tayo sa sanglaan, tapos ipauri natin. Pasabi natin sa nag-uuri ng alahas kung totoo ba yung I love you mo. Parang ganon. Di ba? Pag ina-appraise mo, inuuri mo yung ebidensya. So, appraising is a critical appraisal. In-examine mo na yung buong article to determine para malaman mo kung valid ba siya and then applicable ba to your clinical question. For example, your patients are older adult. Evidence that examines the effectiveness of music therapy for adolescent may not be applicable for your patient because adolescent and older adults have different response to pain and different needs for pain control. So, ina-praise mo yung ebidensya mo, maaaring yung sinasabi noong related lit mo na effective daw yung music therapy sa tao na mayroong such condition para mawala yung pain control. So, yung isang bagay na effective para sa certain groups may not be effective to the other group. So, kailangan i-appraise mo maigi or uriin mo maigi yung evidence na ipipresent mo. And then, applying the result. So, once you have found evidence that you deem valid and relevant to your case, the next step is to choose if and how you should utilize this information in your patient's particular situation. So, apply mo na yung nag-gather mo na data, evidence, na scientific evidence doon sa sample mo, doon sa particular patient mo in a particular situation. And then, the last step would be your assessing the outcome. In assessing the outcome, you should monitor and evaluate changes in outcome. So, ang magaling na nurse, magaling mag-assess. This is the final step in the process. Where or not your intervention was effective. You would be assessing the patient to determine if his pain was controlled with the use of music therapy. You might compare the responses of two patients who have received only music therapy and other who receive music therapy along with pain medication. So, kailangan mo i-monitor. Monitoring the effect of an evidence-based change on healthcare quality and outcomes can help clinicians spot flaws in implementation and identify more precisely which patients are most likely to benefit. So, kailangan mo siyang i-monitor and then kailangan mong i-evaluate yung mga changes na nangyari para magkaroon ng outcome. Yung outcome na yun, yung mga positive effect and then yung mga effective effect ay pwede nating i-carried out. While yung mga negative one ay pwede pa nating pag-aralan uli at saka pwede namang ding remedyohan. Okay, so you need to appreciate how EBP is important to student nurses like you. The evidence-based intervention we'll learn can improve patients' outcomes, help to provide high-quality care, reduce cost, and eliminate practices that have become obsolete or are not effective. As nursing students and future nurses, we hold a promise of continuous learning, and it is essential to build evidence-based knowledge over time. As students, it is never too early to start thinking like a nurse who is driven by evidence-based practice. So, as nursing student and future nurses, you hold a promise. You should promise to yourself and commit yourself for continuous learning. It is essential to build evidence-based knowledge over time. So, as early as now, so, paki-internalize yung maigi, pakihanap nyo sa puso nyo yung pagkoconduct ng evidence-based practice because at the end, lahat ng mga evidence-based practice intervention that you will find out all throughout the course of your research study can actually improve the patient outcomes. And for that, thank you and keep safe, everyone. So, God bless. If you have any questions, just comment on the comment box located doon sa comment section every time of the day when you are most comfortable. Do not private message me. Tanongin nyo lahat ng tanong nyo regarding our our discussion doon sa comment box para mabasa rin ng mga ibang estudyante. So for now, just keep safe. God bless everyone. This is your instructor, Ma'am Josette B. Catabona. Okay, signing off. Bye-bye.